Do you have ADHD? And if so, how do you get diagnosed and how do you treat this condition? This is Dr. Air, quadruple board certified psychiatrist, addiction specialist, and lifestyle medicine physician. First, let's start by distinguishing between ADD and ADHD. ADD stands for Attention Deficit Disorder, and that's a term we used in the past, but not anymore. In 1994, doctors decided all forms of attention deficit disorder would now be known as attention deficit hyperactivity disorder. And there are three types. There is the predominantly inattentive presentation, the predominantly hyperactive and impulsive presentation, and the combined presentation. We tend to see a lot of adults present with the inattentive type of ADHD, while kids usually will present with the hyperactive, impulsive, and also the combined presentations of ADHD. The symptoms of ADHD, depending on the type, can be divided into two broad categories. You have the inattentive symptoms and the hyperactive, impulsive symptoms. Inattentive symptoms include poor attention and concentration, failing to give close attention to details, making careless mistakes, failing to complete tasks, being disorganized, daydreaming, losing things, being forgetful, and being very easily distracted. The hyperactive impulsive symptoms, on the other hand, include constantly fidgeting, feeling restless, talking excessively, interrupting others, difficulty waiting for turns, making spur-of-the-moment decisions without thinking of the consequences, and constantly being on the go. So it's a lot of running and climbing and jumping. And this is what we predominantly see in kids. Very commonly, I see a lot of kids present with the hyperactive, impulsive, or combined presentations of ADHD. And over time, they tend to grow out of the hyperactivity and the impulsivity, and what they are left with as teenagers and adults is usually the inattentive type. Now, studies show that about 5 to 8% of school-aged children have a diagnosis of ADHD, and about 60% of this population actually carry on the symptoms into adulthood. In terms of diagnosis, it usually requires about 5 to 6 of the symptoms of ADHD spanning an extended period of 6 months or more to make a diagnosis of ADHD. And this usually has to be in two different settings, such as at home and at work or school. And there should also be functional impairment. And what this means is that the symptoms interfere with the quality of your life as relates to social, academic, or occupational functioning. Depending on the number of symptoms you have, ADHD can be mild, moderate, or severe. It is common to see people with ADHD also struggle with learning disorders, anxiety disorders, mood disorders like depression, and also disruptive behavioral disorders, again, more commonly in kids. ADHD is a clinical diagnosis, and what this means is that a mental health provider can make a diagnosis of ADHD depending on the symptoms you describe. In some cases, we may require psychological testing as well. Now, treatment generally falls into three broad categories. So we have the stimulant medications, we also have non-stimulant medications, and we have psychosocial interventions. Medications tend to be the first line treatment for ADHD, and stimulants are the first choice. The reason for this is because stimulants tend to be quite effective with mild side effects. In cases where people have heart problems, however, we generally stay away from stimulants. There are many stimulants out there, and these can again be broken up into two broad categories. You have the methylphenidate preparations and you have the amphetamine preparations. The methylphenidate preparations include Ritalin and Concerta and Metadate, and these tend to be quite effective in as high as 75% of people with minimal side effects. Amphetamine preparations, on the other hand, include Dexedrine, Vyvanse, and Adderall. In terms of dosing, most stimulants can be given once a day or twice a day, but this depends to a large extent on the preparation. Some stimulants are long-acting, which means they have a longer half-life, and some other stimulants are short-acting, which means they have a shorter half-life. The long-acting stimulants tend to be more convenient because you can dose them just once a day, and they also have steady levels in your bloodstream, which means the periods of rebound and irritability are decreased. In terms of side effects, as I'm sure you know, all medications have side effects, but it does not mean you will develop the side effects. It certainly is helpful to be aware of the possible side effects you can get with these medications so that you can address them as needed. The commonest side effects with stimulants tend to be headaches, stomach aches, nausea, and difficulty sleeping, which is the reason why you definitely want to avoid taking a stimulant medication in the late afternoon or evenings. In kids, another potential side effect is growth suppression. Because stimulants can suppress growth by a few centimeters, the advice is for kids to take what we call drug holidays. This simply means skipping the medication on weekends and holidays, and what this does is help the kids eat more and catch up on their growth. The second category of treatment is non-stimulant medications. Examples of non-stimulant medications are clonidine, guanfacine, Wellbutrin, and Strattera. These are usually regarded as second-line medications for ADHD because they're not as effective as the first-line medications, which are the stimulants. Strattera, a non-stimulant medication, has a black box warning for potential increase in suicidal thoughts, just like with some antidepressants. Other side effects of Strattera include decreased appetite, stomach aches, dizziness, irritability, increase in blood pressure, and heart rate. So we've talked about stimulant medications and non-stimulant medications. The third category of ADHD treatment is psychosocial interventions. This applies more to kids than to adults and includes psychoeducation, academic organization skills, parent training, behavior modification in the classroom, cognitive behavioral therapy, CBT, and social skills training. ADHD is treatable, and I have seen many kids and adults do a lot better when they're on the right treatment modality. This video is not medical advice. If you suspect you or your kid may have ADHD, talk to your physician about this. Also, let me know in the comments below which ADHD treatment you have tried and how they have worked for you. Subscribe to this channel for more information on mental health, recovery, and wellness. I'll talk to you soon.